So that's what we knew then. We know more today, and what we have more is able to get into a graph like this. And that is these economists giving us this information.
Hello. I'm hoping you are aware of an organization called RAM, which is called Remote Area Medical. It was originally organized to serve third world countries. Last week, they were in LA. They served over 8,000 people, many of whom have jobs, but the insurance companies won't cover. So we are becoming a third world country. With the health insurance reform, we need your help to create it so that I hear you talking about competitiveness with insurance companies. But on a personal note, I need an MRI for both my back and my neck. But my doctor tells me I have to pick one because the health insurance is deciding what I can have and what I can't. As my representative, I really need you to start working. I appreciate you naysaying this plan, but you need to start working to make healthcare affordable for all of us, not just those who have insurance, for those who don't. Thank you.
This lady is absolutely right. That's what the entire debate's about. That is what the marching orders of the Congress is. We have to get a health care plan that is affordable, that we don't have all this cost shifting there, where we're grossly underpaying doctors so they want to not be a doctor anymore, and that new, bright young people don't want to go into the medical field, and we're bankrupting our hospitals. We need to bring in the cost savings where we can, one of many which is about as much as $200 billion from trial lawyers that are suing, but that's only a number. The free up dollars so that we have them to give the health care that we're not giving now.
Hi, Mr. Herger. I'm so glad that you're here today. You've touched on so many things. I had concerns about tort reform, being able to have a job statewide, advertising drug companies on TV and in magazines. Look at the millions of dollars that's spent on that each year. They don't allow advertising for cigarettes. It would seem like that the choice of drugs should be between the patient and the doctor, not something that the patient wants because he saw it advertised on TV. If there's a lot of money to be saved in Medicare, start small. Show us those savings. I know and it should be money taken out of Medicare, but money to make Medicare solvent if the administration really believes there's that much available. When I get a bill, and I have good insurance right now, I'm 2 years from Medicare, but through my previous employer I have great insurance, but when I get the insurance bill and I look at it, it'll say, well, the procedure was $800, and we're only paying 80 of it, and you're not responsible for the rest, which is great for me, but it would seem like that no matter who gets what service, it should be one price. It shouldn't be $80 because I have insurance and $800 for someone else because they don't have insurance. So I don't know what to do about reform like that. And then I guess I have one question. You hear so much about the Canadian healthcare system, and I got online and tried to research, and you get anecdotal things. But I'm just, it would seem, I don't know how many congressmen have actually gone and spent time up in a Canadian hospital, especially get away from the big cities and provinces, or go to England, the same thing, and not just in the cities, and actually research it themselves rather than anecdotal comments. And there's so much back and forth. So I don't know how many have actually been involved with doing that, or just rely on other people to get their information. It's kind of frustrating. I'm terrified of what health care this program would do, and I don't trust anything that's being done there.
Thank you.
Thank you, Representative Herger, for allowing me to speak. Unlike our elected officials, I've actually read 1,017 pages of H.R. 3200. I even read the Senate bill, but I just have one question from H.R. 3200. Although I have 20 pages of notes, I'll just ask one question. It establishes a health board advisory committee, and one of the members of this committee is to be an expert in racial and ethnic. The question is, what exactly is that even in healthcare? And does that mean quotas for healthcare?
Good question. That's undoubtedly one of these boxes up there. One of many, many boxes. I mean, that's our challenge. I don't have an answer to that. Thank you.
I just wanted this opportunity to express my unqualified opposition to any further intrusion by Big Brother government into our daily lives. That includes the suggested provision to force people to purchase health insurance. I think it's pretty sad that in this time that we live in, it seems that every time people perceive their problem, they look to the government to solve it, whether it's Sacramento or Washington, and as often as not, it's the government that is the problem, not the solution. To paraphrase, I think it was Ben Franklin originally who made the comment that those who would sacrifice their freedom for the promise of security will wake up to learn that they don't have either.
Representative Herger, thank you very much for this town hall. You and other congressional leaders have great medical coverage covered by our taxes. Furthermore, most citizens, thankfully a heterogeneous and not a homogeneous group, appreciate government-served Medicare. Soon I will be able to get it myself, thankfully. On the other hand, more than 40 million Americans have no health insurance, while more than 60% of bankruptcies are due to medical bills, and thousands of our citizens die every year due to inadequate or no medical coverage. How do you propose to get huge pharmaceutical industry profits out of Medicare and get rid of the rationing done by insurance agencies right now in terms of what medical care is covered, so that medical care can be enjoyed by all citizens in their pursuit of life, liberty, and the pursuit of happiness? Thank you.
I think these are good questions. I'm the first to tell you, I don't claim to have all the answers. I don't have all the answers, but I'm certainly here working on it, and I'm here to work with you and others to try to make this system work. My concern is, what we do is transparent. What we do in the light of day. We talk about it, we discuss it, we work through it, and we work in challenges that you just brought up that are valid, and work through something that we don't end up something that is far worse than we had before. That's what let's go a little slower, let's work on these, let's bring out and suggestions that maybe you have and others have to make it work better than it is today. I believe we can do that.
Mr. Herger, welcome to Chico, and thank you for coming to this event. My question, during 2000 to 2006, you voted 8 budgets that included $7 trillion worth of deficit. In that $7 trillion was $120 billion a year for the Iraqi people. Today, you're refusing to give American people $30 billion a year for health care. My question to you is, will you ever quit voting party line and vote for the American people?
I would say that's a less than a strong supporter there, and we can agree to disagree, I suppose.
Howard.
Thank you, Congressman Herger, for coming today.
Let me just state on my voting record, I've been in office a number of years. I think my voting record is very consistent. I think it isn't much of a surprise how we are, so I want to thank at least the majority of you.